everyone. Today I'm Twisha Kansara here in front of you. I'm a student of physiotherapy studying my masters in musculoskeletal science from Ashok and Rita Patel Institute of Physiotherapy, which is a Constitute Institute of Charleston. She is Neha Jariwala, she is my colleague, and today she has come with some problem in her wrist and thumb.
Hello.
So Neha, what's your problem?
Actually, doctor, I'm having pain over here, and sometimes it's radiating over here. And whenever I do some functional activities like gripping or twisting clothes and cutting vegetables, I'm having pain.
Okay, so basically Neha is complaining of pain in the thumb area, which is radiating towards the forearm, and she is having problem with the functional activities like twisting, grasping, cutting, etc. So we will check for her swelling and tenderness. So as we can see, the mild swelling is present over the thumb and wrist area. I'll check for the tenderness. Neha, I'll palpate the thumb region. You let me know when it gets pain, okay? Is this painful?
No.
Is this painful?
Yes, it is painful.
Is this painful?
Yes, it is painful.
Okay, so on palpating, the tenderness is present. She is complaining of pain. Now, we will check for the range of motion of the wrist. Neha, what you have to do is, I'll ask you to take your hand down, up. You do it accordingly what I say, okay? Take your hand down. Is that painful?
No.
Further, is it painful?
Yeah, somehow.
Okay, mild. Okay, bring it to neutral. Take your hand back. Is that painful?
No.
No. Is this painful?
Yeah, some discomfort.
Okay. So the free movements of the flexion and extension has not much more pain, but extreme it has pain. Okay, now take your hand towards your body.
Okay.
Is that painful?
No, it's not painful. Okay.
Relax. Take your hand out of your body.
Oh,
that
yes,
pain-
it's painful.
Is this painful?
Yeah.
Okay. So basically she is complaining of more pain on the ulnar side. For further, we'll go for thumb movements. Okay, I'll give resistance. You have to do the thumb movements like taking your thumb out and taking your thumb backwards.
Okay.
First, you'll take your thumb out, okay, and I'll give the resistance. Let me know when it get pain. Do? Is that painful?
Yeah.
Okay, relax. Take your hand back.
Yes, it's painful.
It is painful.
Yeah.
Okay. The thumb movements of extension and abduction has pain. Okay. Now, what I'm diagnosis about the differential diagnosis are there may be. Sorry, one more test to go. We have to compare on both the sides. Neha. Okay. Do you like this? You check first. You go for left. Okay.
Yes, it's
Is that painful?
Yes,
The
it is.
right one?
It's not paining.
Okay, it's not pain. Only the left one is pain. So to make it more confirmatory, we will go with the Finkelstein's test. Okay. In this, the patient will be in high sitting position. The hand will be out of the couch. The hand in neutral. Ask the patient to flex the thumb. Neha, flex your thumb. Okay. The thumb is supported by the other fingers flexed. Okay. Now take your wrist towards the ground. That is in ulnar deviation.
Yes, it's paining.
That is painful. Relax. This confirms that the Finkelstein's test is positive, which means the test is positive for de Quervain's syndrome. Okay, Neha, I tell you, this test which we have performed is for de Quervain's syndrome, from which you are suffering. The de Quervain syndrome basically, it is the inflammation that or else pain or swelling of your tendons on your thumb area. Now what happens in normal individuals, what happens is the two tendons, that is the extensor tendon and abductor, extensor pollicis brevis and abductor pollicis longus. The both tendons pass beneath one sheath, that is called extensor retinaculum. Now in normal individuals, they glide very smoothly beneath the retinaculum. But what happens in de Quervain's syndrome is these two tendons get thickened. They become thick and the tendons, it gets inflamed and it becomes narrow. So what happens is there is very much restriction in your thumb movements. Now whenever you do your activities like repetitive use of your thumb, this causes increased tendon in these two structures, which leads to friction again of the two structures, and which will result in your pain and swelling of your thumb, from which you are suffering. Thank you.